Are you fatigued, exhausted, extremely tired? Maybe activities that you used to enjoy just seems totally unsurmountable. You don't feel you have the energy. Going up the stairs is really tough. Even tasks that you used to enjoy, maybe yoga, reading a book, watching a movie, even doing nothing, and you just feel exhausted. After sleeping, you're still really tired. You have no energy. What could possibly be the cause? Well, there are so many reasons why you could be excessively tired. It could be your diet is not containing the nutrients you want or the body needs. It could be your diet is actually pretty good, but because your digestive system is not really working properly, that could be the reason the body is not getting the nutrients it wants. Maybe you're low on stomach acidity because you're generally low on stomach acidity, but it could be because you're taking proton pump inhibitors. It could be the amount of protein in your diet is down, which then doesn't trigger sufficient stomach acidity. It could also be you're taking something your body doesn't sit well with. It could be you have gluten in your diet, and you may not be gluten allergic, you may not have a celiac disease, but you could still be sensitive to gluten. Maybe the gluten is causing inflammation in your body. Maybe you have a gut pathogen. Maybe there's a parasite. Maybe there's a parasite from your traveling 20 years back, but because now your immune system is down, that parasite might actually get the chance to multiply and create problems for you now, 20 years later. Now, what if your GI tract is working perfectly well, but your adrenal system is not okay? Maybe you're so stressed in your private life, family life. Maybe you need to care for your parents. Maybe you have to care for a disabled child. Maybe you have financial issues, or it could be that your boss is really giving you a tough time. All of that could trigger changes in your adrenal gland response and production of cortisol and adrenaline, noradrenaline. You could be deficient in a number of neurotransmitters, causing you to develop this fatigue. It could also be you're lacking very important nutrients simply because they are not there in your diet. It could also be that although they're there in the diet, you're not able to digest and absorb them. It could also be you are having the perfect diet, you're really having a good gut lining and it's working properly. The stress is maybe not that bad, but maybe the status you're taking is reducing the CoQ10 production. You need CoQ10 to produce energy in the mitochondria. It could be that is the reason you don't feel like you have any energy. You're not able to do what you used to enjoy. There are so many reasons why you could have problems with your fatigue, why your body is not wanting to do what you used to enjoy. Maybe you're suffering from hypothyroidism. Maybe it's iron deficiency caused by your monthly periods. Keep in mind, iron deficiency is the most common nutritional deficiency in the world. Women in their reproductive age spend roughly 25% of their time losing blood due to their monthly periods. That can cause iron deficiency. If you have iron deficiency, you are not able to produce enough blood cells maybe. And you need the red blood cells to be able to feel well. Iron deficiency could be the reason you are not performing as well as you want. It could be the reason you're fatigued. But what is exactly the cause in your case? Well, I don't have a clue. That's why we'll give you some questionnaires trying to narrow down the possible causes of fatigue in exactly your case. That is why, apart from extensive questionnaires, we also will try to do more extensive testing as needed according to your story, according to your symptoms and signs, according to your replies in your questionnaire. We may need to do normal blood testing. We may need to do some hormonal tests. It could also very well be we need to do some urine samples. We may need to check your gut. Is it actually ready to absorb the energy and the nutrients your body needs? Is the gut struggling with the pathogens? So maybe there are no pathogens, but the microbiome, the natural bacteria that you should have in your gut, is not balanced properly, which is then causing you to develop fatigue. When we work with a patient, we go into those details. We want to understand what is a likely cause, or rather, what are the likely causes of fatigue in your situation. We don't just settle with saying, well, okay, we found low iron in your blood. We'll give you some iron tablets. But when you have low iron, it could also cause you to develop hypothyroidism. It could also cause you to develop many other things. And the question would be, why would you have low iron? Is it your monthly period? Or is it lack of stomach acidity? Or is it because you're vegetarian or vegan? Or is it because even though you're not vegan or vegetarian, you're not taking enough red meat? What exactly is at play in your situation? What do we need to address for you? This is how we work. If you are fatigued, if you really are exhausted, if you don't have the energy to do anything, just walk up the stairs or getting out of bed. Maybe it's the time for you to dig deeper to understand what's happening in your body, to do a much more extensive analysis of your symptoms, of your signs, and then decide what further testing is required to help you. If you're ready for that, you can book a discovery call. And let's go into the details of exactly your story, your life, your body. Thank you for watching.